Thank you for watching this video for up-to-date news from the VABC Association. We have uncovered deep evidence, all available through public filings, through a series of investigations that AVA, also known as the AVA, or Association for Vascular Access, VACC, also known as VACC and Vascular Access Certification Corporation, and Institute of Credentialing Excellence and their NCCA have engaged in fraud. Let us explain to you the matter in plain English. These three entities lied to the IRS, donors, healthcare community about their companies and position in the marketplace and engaged in what we found were over 62 counts of fraud with IRS filings and other national public available documents. It is our belief that board members at the highest level are involved. It is our belief that board members engaged in agreements that hurt our healthcare workers, us, donors, patients, the public, and anyone who entrusted them. A federal court filing has been filed, and when given permission, we will be releasing all these public records in source sync order so that you, the public, can see what they did, how they did it, and why they and their board have been banned from our platform. Thank you so much for your time, and we look forward to the great reveal to protect you, us, and patients.
The Federal Trade Commission has been given notice to immediately investigate the nonprofit organization of the Institute for Credentialing Excellence and remove the NCCA certification to its entire platform. We believe and fear that a false NCCA credential is a risk and widespread safety issue affecting the healthcare industry and safety of patients. Despite receiving cease and desist notices and having actual knowledge of trademark infringement and discovering fraudulent activities involving AVA, Association for Vascular Access and VACC, also known as Vascular Access Certification Corporation, the Institute for Credentialing Excellence and its accrediting body, NCCA, willfully failed to take corrective action. By concealing these material facts from the public and declining to initiate the investigation required under their oversight and fiduciary responsibilities, they engaged in willful negligence and a breach of duty. This deliberate inaction not only perpetuated public deception, but also constitutes a failure to uphold the standards of transparency, accountability, and good faith required of organizations operating under nonprofit and accrediting authority. In addition, in our discoveries, we found some extremely alarming concerns. No filings as of this date for 2023 and 2024. Public records show that in 2022, the Institute for Credentialing Excellence, a nonprofit, reported $2,976,759 in revenue, yet paid $1,765,833 of that directly to Smith Buckland Corporation, which is a for-profit management company. This means over half of its nonprofit earnings went to enrich a private corporation, raising major concerns about accountability, board members, and misuse of nonprofit status. Further investigation also uncovered that the Certification Trademark Institute of Credentialing Excellence filed with the U.S. Patent and Trademark Office was fraudulently filed, since the organization profits from member fees and management contracts, disqualifying it from holding certification status under USPTO rules. Together, these findings point to serious misrepresentation, conflicts of interest, and potential abuse of public trust. Because of all this being tied together, with these three organizations financially benefiting from each other and concealing each other from credentialing fraud, providing healthcare certificates for years and years that were invalid and not legally bound by law, and what was clearly uncovered in IRS reports and other items discovered by whistleblowers, investigations, and public records, the Institute of Credentialing Excellence has been reported to federal authorities for contributing to nonprofit healthcare fraud.
You're watching and listening to VABC Association News, corporately located in Arizona and trademarked internationally.